All right, so thank you everybody for joining us on what is a beautiful day in the Treasure Valley, although it's been coming and going, a little cloudy, a little sunny, but hey, that's spring in Idaho. I had a colleague who was up at Priest Lake last week, and he said it's even spring-like up there, so we are in good shape to start feeling like things should be green and growing, right? So with that, just wanted to, again, welcome everybody to our, our April, April, we're still in April 15th, Tax Day meeting. Hope you all are calm and de-stressed about that particular activity that we all get to do. And we are going to actually get started with some introductions. So we haven't done this in a while. So what I would like y'all to do is, first of all, to put in the chat, which you can access, I believe, from the top right of your toolbar, into the chat, your name, your title, and where you work. So, for example, I am Erin Olson. I am a program specialist running the Disease Prevention and Health Promotion Program with the Idaho Commission on Aging, and for our concerns, also the Falls Prevention Coalition of Idaho. So we're going to toss it around, so make sure you know who's in here. I'm going to toss it over to Timothy. Take it away.
Hi, I'm Timothy with Eastern Idaho Public Health. I'm a health education specialist. I did coordinate 4 programs up until a few minutes ago. Fit and fall proof and PAN, suicide prevention, cancer prevention, and diabetes. And I'm on this coalition, and I'm happy to be here.
And who do you want to toss it to?
I'll toss it to Carolyn.
I'm Carolyn Jager, and I also coordinate Fit and Fall Proof up in Coeur d'Alene, and so that's District 1.
And who do you want to pass it off to?
Oh, sorry. Next part. Let's do Julie.
Hi, so I'm Julie Harrigan. I'm also a Fit and Fall Proof coordinator out of District 2 in Lewiston. I'll pass it to Jim.
Hi, everybody. My name is Jim Phelps, and I am the Development Director for Treasure Valley Habitat with our headquarters here in Boise. And I will toss it to Mason.
I think that's me. That's what most of my friends call me, but first name is Keith. So I'm Keith Mason. Hi, I'm the CEO of the United Healthcare Community Plan of Idaho, which is going to be tasked starting 6/1 of this year with administering benefits and managing individuals in the IM Plus and MMCP duals programs.
And we will be hearing more from Keith after we get a couple of introductory things out of the way. So welcome, Keith, as I think our only guest here today. Do you know who you want to pass it to?
I'll pass it to Todd for the win, please.
Hey, Keith, good to see you again. Todd Holcomb here, Director of the Area 2 Agency on Aging in North Central Idaho, so based out of Lewiston, and happy to be here. And I will pass it to Sarah.
Good afternoon, all. Sarah Taves with the Idaho Caregiver Alliance, and I'm also a part of the Fit and Fall Proof statewide evaluation team. Glad to be here and to see everyone on board. And I'll pass it to, let's see, has Timothy gone yet?
Yes, I have.
Okay, I'm afraid I was distracted there, so maybe I'm the last. Or Brooke. How about?
There we go.
Yeah, perfect.
Yep, I have not gone yet. Thank you, Sarah. So my name is Brooke Ambrose, and I support both the IPAN program with Fit and Fall Proof and the Alzheimer's disease and related dementia programs at the Department of Health and Welfare. Lots of words. Chat with me about whatever sounds interesting. I will pass it off to, is that Stephanie?
Yep, that's me. I'm Stephanie Shattuck. I'm the Traumatic Brain Injury Program Director at Idaho State University. I'll pass it on to, I think Anna Beth hasn't gone.
Hi, I'm Annabeth, and I am the nurse at Link, and we work to help people stay independent in their home as long as possible. And I'm glad to see so many people on the call today.
Me too.
Yeah.
Who's left?
Is Caitlin on?
I'm not hearing her.
Okay. Help me out. My screen is reflecting and I can't see it. Who hasn't gone that would like
Who
to
hasn't gone yet? Who do we have left? Maybe we got everybody.
I haven't gone yet. Just really quick. Hi, everyone. Daniel Adams, Fit and Fall Proof Coordinator from Southwest District Health, Public Health District 3.
Excellent. We didn't mean to miss anybody, just trying to keep track of who's here. Is there anybody else that hasn't had a chance to do a brief intro? Going once, going twice. Alrighty then. We technically always have this little time to perfect the agenda, which really just means all of you received the agenda yesterday afternoon. Did anybody have anything that they wanted to add to the agenda for today's collaborative? Again, if not, that's good because we actually have a lot of things to cover it. So we will go through the agenda as it was distributed yesterday. All right. So let's take just a few minutes to do some individual updates. And I'm going to kind of pick on a few people just to make it so we know who's going to talk. Jim, do you want to tell us how your RAMP project went?
Sure thing. The ramp project is still going. We did have a pretty big request from folks who need ramps. I think we ended up with 17 or 18 in our pipeline, and we're scheduling them out into summertime right now. But we're knocking them down one at a time. We're up in Eagle building a really big ramp today. But we're basically building, installing one ramp per week at this point. We're certainly open to receiving more inquiries. So if anyone's out there and they know someone who needs a accessibility ramp, just contact us and we'll get them into the queue.
That is really a fantastic service, and most people have no idea how much it actually costs to build and install a ramp that meets requirements. And that's the other part of it, is that it can't be too steep, but people have to be able to safely utilize it. And so get somebody that knows what they're doing, like our friends at Habitat for Humanity. So great to hear it, Jim.
You bet.
Let's see, who else do we have? What about the Falls Prevention Conference that's coming up in Idaho Falls? Timely, do you have any other updates you want to give us since last month?
We're still planning on holding it on September 6th. Let me just refer to my notes really quick. In conjunction with Eastern Idaho Regional Medical Center, we're going to get all my pharmacy there, dietary, nursing to do vitals, hearing, some internal medicine, some cardiac pulmonary, fit and fall proof sample classes, some swag bags, and then information for them to take home on home safety as well. So
excellent.
Yeah, we're excited for it.
I was wondering if Stephanie, we've talked about your TBI assessment that people can do on their own. It doesn't require a clinician to do it. Is that correct?
It requires a person to actually ask the questions and go through. I can train someone how to do the TBI screening in about 15 minutes. So it's not something that's going to take a long time to train someone, but someone does have to walk someone through the questionnaire.
Okay. So anybody that's doing any of these events that we're going to be talking about, if it's possible to have someone, and that would be the perfect thing for a nursing student, a PT assistant, anybody with any kind of background that can be professional and talk to people easily. We really want to start making sure that we include TBI as part of falls risk. So we will definitely be getting into more details about that coming up soon. So great. Thank you, Timely. Let's see. Jeanette, what about the ISU Geriatric Symposium? Is Jeanette here? I thought she was here. Or Michelle? Okay, if not, then I will just tell you, we do have the Idaho State University annual Geriatric Symposium. It's a Wednesday, October 15th from 2 to 5 p.m. at Idaho State University. Their theme or their focus this year is going to be on isolation and loneliness, which, as we know, ties in with everything that has to do with general health, but especially increasing falls risk. So that will be an excellent one. And we will again have representation there as well. Let's see, Bob isn't able to make it. One of our challenges is that we might need to change the date and time of our meetings because many people now have required meetings the third Tuesday at 2 o'clock. So we'll talk a little bit more about that later, but that's why Bob isn't here from Boise State. But I did go to the neuroscience day at Boise State. It blew my mind. It brought back all of the, we'll just call it fun facts about neuroscience that I have forgotten over the years since I did anatomy and physiology and biochemistry and all of those things. But really a lot of interesting things that we can tie into falls. And I might ask Bob just to share some of the highlights of that, maybe in an email message so we don't take up too much time. But that was a really fun event. And guess what? For the end of day kind of meet and greet poster session, they not only had an open bar, but they also had a chocolate bar with like 5 or 6 different kinds of ooey gooey chocolatey things, and it was wonderful. So got all my endorphins going, obviously. Let's see, anybody else have any announcements, local information, things that are going on that you want to share before we move on? Okay, well, I did want to thank all of our Fit and Fall Proof people for being here today. That's excellent. A couple of you who also haven't been able to participate with us live in these meetings for a couple of months, glad to have you all back. And anybody that's doing any kind of event, community type of thing, don't forget, it's always a good place just to give out some literature, our brochure on falls prevention, bring up that awareness and those kinds of things. So with that, it would be my pleasure to actually update you about the grant. And that is because, I thought I was off a bit. It would be more of my pleasure to introduce Keith Mason. He already introduced himself. He has kind of a long title of Chief Executive Officer of the Community Plan of Idaho, something like that. I'm going to let Keith share with us for 5 minutes or so, a little bit about who he is, what United Healthcare is doing in Idaho, and anything else he would like to share. So take it away, Keith.
Hey, thanks, Aaron. And my title is actually very short. It's 3 letters, CEO. You don't need to worry about the other stuff or pollute your email with big, long titles. So that's the first part. I am Keith Mason. I'm currently in the Boise area. I don't live here permanently yet, but will be doing so by the end of 2025. I live in Indiana and I fly here on a weekly basis. So Monday through Thursday, you'll see me somewhere in Idaho. Working with a variety of stakeholders. United Healthcare, for those who don't know, has been in Idaho since about 2009 as it relates to the Medicare products and commercial products for individuals. and we serve about 63,000 individuals in that area. Last year, the state put out a request for proposal for managed care entities to manage the duals population in Idaho. What that means is individuals that are able to get both Medicaid and Medicare and that are 21 years or up. And so the current incumbents are Blue Cross of Idaho and Molina. Those two plus us plus another company put in responses. It went through a competitive process, and the state recommended that Molina and United Healthcare come forth into the future to manage that program. That was a 1/1/26 implementation launch date for us to do that. A couple weeks after that, in December of last year, the state asked us if we would come in early to the tune of June 1st of this year. So I am the responsible party to bring up a brand new Medicaid health plan in 6 months and make sure that we are ready to manage alongside members their benefits that are in the duals population. And so we will be launching on 6/1 with Medicaid product, which is long-term services and support mostly. So personal care services, homemaker, that kind of stuff, and a little bit of behavioral health and a little bit of vision. But we're secondary payer pretty much to all things medical because we're just on the Medicaid side for 2025. And on 1/1/26, we'll launch another program called MFCP, which means we'll have a person's Medicaid and Medicare all in one place. And we will holistically manage those individuals, moving forward. And so just very busy, meeting with a lot of stakeholders, working to better understand the ecosystem, better understanding what we can do to enhance these individuals' lives, as well as enhance the ability of stakeholders like yourselves to do what they want to do. So to that tune, we have worked over the past years from an investment standpoint with Aaron, just to talk about possibilities as it relates to potential resources in falls prevention. I've worked with some of the AAAs on transportation, some of the CILs on DME products in their loan libraries, worked with the Alzheimer's Association to provide licenses and incentives for direct care workers to better understand Alzheimer's, and done a variety of other things with community health representatives and tribal or diabetes, just again to amplify the ecosystem. And so why am I on this call, you might be asking yourself? Well, with my 1 minute left, it's because falls prevention is a big deal as it relates to the duals population. These individuals are super complex, 21 and up. If you look at the 20,000 roughly individuals in the duals program, I would say about 50% of them are 65 plus, 35% are 45 to 65, and the rest are 21 to 45, which might surprise you. So we potentially get a member at 21 and have them for a very long time in their life. And I think as we look at opportunities to enhance their quality of life, reducing their falls either through durable goods such as adult products or ramps or different technology, that's something that we want to explore. And again, I've been talking to Aaron for about a year about how we can work out and help, and how we can be an ongoing participant at this table, because it's something that will be important to us to get in front of and figure out how we can do something about it. So any questions, comments, concerns about that?
Yeah, that's fantastic, Keith. And what I love about Keith when I first met him was he dove right in. He knew that falls were happening, that they have all of those negative outcomes that we all know about. And he just has lots of ideas about ways we can start to address those with products and services and coordination of stuff. So every time I talk to him, I get excited again about all of the possibilities. And I think, United Healthcare is the first insurer that has actually engaged actively with us. So thank you for that, Keith and United Healthcare. And hopefully we'll have some more. But as he asked, does anybody have any questions that you want to ask him while he is here? Sometimes it's hard to kind of get your head into that space, right?
Todd's already
one of the
asked me a
things
lot of
he-
questions, so he's not going to hit me up on this one. So it's all good.
Oh yeah, we know more is coming. Can I,
Yeah,
if
it's
I
okay.
might share, I probably should have shared this, Aaron, when you asked if we had news to announce, but Area 2 is hosting a senior conference called Roadmap to Aging. That'll be on May 3rd. Advanced planning is our theme. And Keith, will you be the one speaking, or will you have a representative come speak?
I'll be there.
You, all right. So
Yeah.
Keith himself will be there representing, which I thought was a huge opportunity to add to your road show that you were already doing. So I will hold my questions for then.
Yeah, so
It may
he
have some
mentioned,
pop up.
yep, no problem. He mentioned a road show. So United Healthcare, Molina, and IDHW did a road show starting early March through a little bit of April, in which we went to 15 different cities throughout Idaho, met with members that are in this program currently to better understand their concerns, talk to them about the changes. And then we also met with HCBS providers in those same locations to better understand their concerns, discuss the transition. And this was from Boise to Jerome to Blackfoot to Sandpoint, Kellogg, Lewiston, Moscow, and in between, right? And so it was a very good way to see the diversity of thought and perspective and need that these duals have. So.
Absolutely. And I think as you were talking about what those needs are, that pretty much every one of us deals with clients who probably fall into many of those categories. So, well, Keith, thank you for being here. If you do have questions, I am hoping that Keith will be a regular part of our group, maybe not all of our collaboratives, but at least if you do have questions, we can probably have them go through him at any point in time in the future. So if that's the case, just let me know. Thank you very much, Keith. All right, now we're moving on to the grant. The grant. They did put out the awards last Friday, and we did not get one of those awards. So we don't look at that as a good or bad. Remember, it's just a thing. Interestingly enough, ACL will be relaunching 2 grants, which I thought is really odd with the way things have been pulled back and taken away. One is strategies to deliver evidence-based falls prevention programs to older adults with behavior health and or chronic conditions. And the second one is expanding strategies for community evidence-based falls prevention. We obviously can do either or both of those. They are supposed to be posted on the 23rd. When that happens, I'll take a look at the details, and I tell you, I'm not really excited about writing 2 more grants after the 3 earlier, but we will, because that will help get us the funding that we need. So I'll let you know the details about those in the future. We don't know when the deadline will be or when they will be awarded. All righty, let's move on to our strategic planning committee. I am happy to announce that we have an 8-member strategic planning committee. I know we should have an odd number, but I just couldn't narrow it down and really didn't want to add one more. But we have selected those people, be working with the strategic plan coming up soon. We couldn't get absolutely every demographic group that we wanted to, but we have a really good representation from around the state, male, female, northwest, central, southeast, different professions, different types of lived experiences, those kinds of things. So for your information, includes Caitlin Gaines, who is our PT from North Idaho, Kate Wilson, who is formerly Fit and Fall Proof. I'm not actually sure of her title right now, up at the Health District in North Idaho. Dr. Caitlin Kinahan, who represents the VA as well as being a physician. Let's see, Anna Beth is here and represents the SIL, Living Independence Network. Who else do we have? Jim is here representing the home modification and a couple of other not-for-profit type groups. And Jeanette Olson, who's not here, represents our academic in East Idaho. And finally, we have David Thompson, who is a AAA director, which will be helpful, and myself, and I get to be the tiebreaker if that 8 number becomes an issue. So work with that group will begin next month. We'll determine the timeline during our first meetings, and we'll take it from there to get all of our foundational documents and things in alignment. And of course, they will be presented to us, the steering committee, for final approval when that happens. Are there any questions about the strategic planning subcommittee? And I am going to apologize because I'm having a little bit of a MS thing going on, so I am just going to sit down. Hopefully you can still see me though when I sit down. Can you still see me, or am I way too low?
We can see the top of your head and your eyes.
Well, what more do you need to see? Okay, let me lower.
We don't. You just get comfortable.
Let me lower
hear
this
you.
a little bit. Don't worry, that was just my standing desk. So that should be a little bit better, I hope. But if not, you just get to look at the top of my head, I guess. Okay. So like I said, that's something that will be in process. We don't know quite how long yet. We need to figure out, how we're going to approach it, how often we can schedule some of the things we need to do. And depending on funding, the big win on this would to be able to have a 2-day in-person strategic planning meeting to pull it all together, get the final document put in, and possibly even have a consultant who knows how to do all of this stuff, who can do that effectively and efficiently and create the final document. So stay tuned, but the strategic plan and all of those related goals and objectives and outcomes will be forthcoming in the next, we hope, about 3 months, give or take. All righty. So guess what? It's already time for Falls Prevention Awareness Month. Believe it or not, we're just leaving April. We have until September. Thank you, Keith. We have the opportunity to kind of get ahead of the curve this time. So I just wanted to talk about some of the things that we should start doing. The first is that we want to have local proclamations. Let me excuse me while I move here. Okay. Local proclamations. Now, I will do one for the governor and hopefully get a signing ceremony. Last year, he did not give us a signing ceremony, even though we got the proclamation. But I'll be drafting, really just that, a draft that you could use, and you could add some local information if you have any. Like Stephanie, you work with traumatic brain injuries. So if you have different statistics or things you want to focus on, that would be great. But we want to get those out, not too early, but not too late. And we'll have a timeline coming up. But what we need is to have you guys in the local area start collecting the contact information from your local media, news, radio, or TV, rather, radio, newspapers, anybody that does a community newsletter. What are your libraries in your area that could post information, maybe even host a seminar, things like that. And when we get that, it would be great if you could submit the list, have not only the call letters or the channel or the station information, but also who should we be talking to? Because, when I send these out and they just go in a blast, it's like the shotgun effect. You hope it hits the right people, and often it doesn't get there if you can't address it. So any local people that you can find, And that might just be making a phone call and saying, hey, who is your person that covers either senior or older adults or health or community safety? Any of those kinds of things would be awesome. And if you can kind of send those in, we can start collecting them now. We definitely want to have our local representatives from the civic area, mayors, county commissioners, the state legislators from your area, from your districts would all be fantastic. Like I said, also radio, TV, newspaper outlets, all of these preferably with a specific name. And phone number and email address are awesome. And that will just be fantastic. I've kind of worked, and I do have a list, but I also know the list has aged and many of them come back. So I need your help to be able to get this information. So we'll talk a little bit more. I'll send out an email about that a little bit later. Any questions about building up your local contacts for people that would be interested in falls prevention and promoting healthy living? I think you all are pretty good about that. Okay, so the next thing about Falls Prevention Awareness Month is our seminars. They are really kind of our trademark. That's what we started with. They've always been done virtually until a couple of years ago when we did do the one for health professionals live at ICOM, the medical school, which is really nice. But as far as seminars, let's think about keeping what we're going to call seminars as virtual, just to keep them in a nice clean category. We have the ones that we have been presenting now starting the first year all the way up through last year. Why falls matter and how to prevent them. That's kind of the basic information about all of the falls risks and how people can tell if they are at risk of falling. Then we have simple steps to improve balance and prevent falls, which all of you FFP people should love, because we have had Kate and Julie demonstrating live and having people follow along how they can do exercises like fit and fall proof, standing or sitting, to help improve their balance and their strength and their flexibility. We have also done, of course, the recognize and remove trip hazards at home. Thank you, Jim. They've done it for the last couple of years. And that is, again, how do I know what might be a trip hazard in my home? And, many of them are very easy, simple fixes if people are just aware of them, like what is your lighting in a stairway? If it's very dim, then people can trip over the stairs. So lots of good tips and tricks on that one about preventing trips, slips, and falls at home. Let's see, what else do we have? I'm forgetting a couple. Last year we added understanding your pelvic floor, which had to do with continence. As we know, especially in women as they age, continence is an issue. And when they have continence challenges, they're more prone to fall because they're rushing to the bathroom, and they're rushing, or it's nighttime and they trip over the cat sleeping in the hallway, those kinds of things. So it really is related to falls prevention. But also it has to do with, the self-confidence. I may not want to leave my house if I worry that I'm going to have an accident while I'm out. So they tend to be less social, and they get isolated, they get less physically active, and all of those things that we don't want to happen often happen. So addressing continence is a really important thing, but it's also one of those taboo topics. People, I can't talk about that. So we're just bringing it to light. Another one that we added last year was talking about falls, which is primarily for people who are caregivers. How do you talk to a person that you are caring for about their risk of falling without making them worried that you're trying to find out so you can take things away, not let them do what they want to do, possibly even put them into a nursing facility or something like that. So those are the ones that we have. My question for you is, And we have already talked about some of the events that you guys already have going on around the state, which is fantastic. But do you have any other ideas for these seminars that you think would be good to offer in the August, September, early October part of the year? We hear crickets.
Hey, Erin, this is Annabeth.
Yes. Yes.
Hi, I think it would be beneficial for a pet trainer or vet to talk about how to keep yourself and your animals safe. Because
I think so too. And we've talked about that one. It's actually on the list. And I think that would be a really interesting one because people do love animals. They do love their pets. And I think it would just be interesting for them to go, oh, you know what? I never thought about the fact that my cat likes to come up and stand behind my legs when I'm cooking in the kitchen could be a trip hazard, obviously. I think we should add that one. Do you think that one should be an hour? Or do you think it could be a little shorter? And I'm only asking because right now we have one that's 90 minutes, all of our others are an hour. And I'm just wondering if we could do like some lunch and learn style where there are 30 minutes maybe to give information. Have you thought about that, Annabeth?
No, but I like that idea. I think 30 minutes would be adequate.
I think so too. Does anybody know a veterinarian or a trainer they want to recommend for that? If you do, send me the information. I know that's probably like so not in your brain right now, so I won't expect too much. Another one of those that we have talked about in the past that might be good as a short lunch and learn kind of thing is also just about proper footwear. You know, how does proper footwear impact your risk of falling? And how do you know how to buy shoes? I mean, I know I just go into a store and I try them on and go, yeah, okay, they don't feel bad, so I guess they're okay. And last time I was at my doctor and we were talking about falls, he actually said, and blah, 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 shoes, not like those. He points to my feet as in the ones I had on. I was like, okay, then what does make a good shoe that, you know, doesn't necessarily look like an orthopedic shoe that used to be, you know, not fashionable that many people are concerned about. Alrighty, so any other recommendations or ideas for any seminars?
Erin, I don't know if this would be this is Carolyn in District 1. If it would be one that would be specific or a long one, but maybe touching on walking and getting around in the cold ice and snow.
Yes.
We get that up here, and I know there's a lot of areas of Idaho. And again, it wouldn't have to be super long, but maybe just touching on it a little bit for safety purposes.
Absolutely, that would be excellent. And I'm trying to remember who, our good friend, Dr. Bob Wood, told me just the other day that he actually is certified to teach some of the Tai Chi classes, which is where I learned how to walk. I remember spending a whole afternoon at our botanical gardens in a Tai Chi class learning to walk. I didn't know that I didn't know how to do that properly. So especially on ice, like you said, or, you know, sand or gravel like that might roll under your foot.
Right. And like we have ice. My dad fell in his driveway this winter because he was out getting the paper, and it was a hill. And so I don't know, just things like using a little grabber instead of bending over for the paper, or keeping sand in a water bottle in your car door for if you get in a slippery parking lot, just little tips like that. That's what I share with my people. So it might be helpful.
Fantastic ideas, because you're right. It's not just as you're walking, it's keeping your body in balance so that you don't slip on that ice, things like that.
Happens
Jim,
fast.
you might have a few things that you could talk about as far as especially the, you know, the outside, the approach to people's homes, their stairs and handrails and things maybe.
Yeah, we're always up for talking about how we prevent stuff. and kind of doing our whole home assessment, you know, because there's a lot of things to consider, and Jake is so great at that. And so, yeah, I mean, we're always up for that.
Excellent. Excellent. I like that one. That one might actually be, as I'm thinking, might actually be, you know, the 45-minute to hour-long one, because we talk about, you know, moving our bodies safely. What aids do we have, like the grabber or the handle you can attach to your car door, the approaches to our homes, getting in and out, and stairways and things. And I've been talking with the Meridian Fire Department, and they have some ideas on things like that too. So we might just add that as a full-blown regular seminar. That's great. I'm really excited.
Something we could add to
Yes.
that too is I noticed a lot of men, when they hit 60, they fall off of the roof and off of ladders, and maybe talk about that and include resources of who could help you so that you're not up there doing it.
Yes, yes, that includes some of the programs that possibly Habitat does, but our chore program might be able to help with some of those things. And yeah, there are definitely resources to help people so they're not getting up on their roof, especially when it's icy. Excellent. All right. Well, we will run with that idea. And when the consumer education KPA gets together, we can kind of hash out the topics and things that we want to cover. Fantastic ideas. Yay. Anybody else have any ideas before we move on? Okie dokie. I will tell you that I am looking for specifically the one that we have not trouble, but yeah, challenges getting, is we need a pharmacist who can talk about what medications do that increase risk of falling, polypharmacy, things like that. Also a dietitian or a nutritionist. We have a bunch of them in the state, but somebody who is eager and excited and effective at talking to people virtually about how diet can impact your falls risk, especially hydration. And let's see, of course, we'll need to get some of these other specialists that we just talked about, an orthopedist or somebody to talk about footwear and those kinds of things. So, all right, remember, if you guys have any ideas of people or things that you either are going to do or that you want us to do as the coalition, please do not hesitate to let me know now, so that we can get all of this done. It's become a really big campaign, and it does take a few months to put them together, and more importantly, to get the people that we need to be able to schedule their time. All righty, like we already mentioned, we do want to include more traumatic brain injury assessments as part of any of our screenings or other kinds of events. So please let us know what events you have. If there are people who are willing to do those short assessments, again, Stephanie, there's no prior knowledge or experience or certifications required, and it's a very short test, but that way we can have people make sure that we're getting the traumatic brain injury in as part of our falls prevention efforts. Stephanie, did you want to say anything else about that assessment?
It's 5 questions. It is pretty simple. If somebody wants to train a group of people, I can do that. If somebody just wants to be trained themselves, I can do that. But it's fairly simple. It's evidence-based. We use the OSU TBI from Ohio State. It's considered the gold standard for TBI screening. So if anyone's interested, reach out. Probably easiest way to get a hold of me is tbi@isu.edu, and I can throw that into the chat too. But if you're interested in being trained, or if you have a group, I'd be happy to help with that.
That would be fantastic. So right now, just in case you didn't know, Stephanie is our TBI subject matter expert for all things TBI, as the rest of us, learn. And I know that some of you work or learned about that as part of your education or your profession. But she is also collecting the data, which is another thing that we want to make sure that we can get some good data on how traumatic brain injuries and falls impact each other. All right, my friends. Well, let me check my time because I kind of lost track. Oh, we're not doing too poorly at this point. Let's see. I did want to talk just a little bit more about which one do I want to do? About the grants. We obviously wrote the one grant that was specific to building the coalition. Like I said, I haven't seen these reposted grants, but I'm assuming we will be able to reuse a lot of what was written for that other grant. Who knows what format, but that's always easier than starting completely from scratch. But again, I will let you know the details about those when they come out a week from Thursday. I think that's the 23rd. Somewhere around there, a week from today, and let you know what we're going to pursue and if there are things that some of you might want to be involved in, because we want to include those in the grant as well. We did include a few things in the last grant that aren't going to happen, that I have let the people that were kind of looking forward to those, let them know that they aren't going to happen yet, but never say die. there's always other grants, other ways, and kind of like with our strategic planning, we don't have the funding to do it, the whole big kahuna like we wanted to do, but that doesn't mean we're not going to do it. We just have to do it in a more simple way with less costs associated with it. So that will hopefully be something to look forward to. Grants will be helpful. I did talk with my ICOA leadership team, because in the grant that we have not received, we had a chunk also to work on our branding, our logo, getting some templates and things with a basically an admin to create some of those things for a newsletter, for email, that kind of stuff, for basically all of the types of things we need to put out, including brochures and flyers. I might be working with the ICOA outreach and education person. I might be looking for some interns to do that. I'm going to have a meeting about that a week from tomorrow. So I will also let you know about that. Right now, I will just say that if you know anybody who is a graphic artist, all we need to do is figure out what to do with that eastern side of the state. If you remember, our logo has a state of Idaho with FPC ID, and what we wanted to have going up the jagged side of the state was basically 2 or 3 people, kind of arms linked together or holding each other, because that's the coalition part. And climbing up is kind of the physically active, not falling part, something like that. And unfortunately, it can't be done with just putting in clip art, which is what was attempted originally. So we're looking for somebody with some graphic arts ability, really just to do that one part of the logo. If you know anybody, let us know. At this point, we will be proud to give them all the credit they want. If we get any funding, we'll be more than happy to pay them for some of their work. But we haven't been able to find anybody that says they are willing or able to do that yet, other than professional people, and we need a grant to be able to afford that type of work. That will then allow us to move forward with these other types of materials that we're talking about. I really want to have our good logo to put on those and not use the one that we currently have, which is okay. But remember, it was a guy that was climbing up the side of a mountain with a backpack, and the person who designed it kind of erased the backpack, but it still is a person kind of climbing up, and not exactly the positive thing that we want to put out there. So I will stop talking about that and just make this other claim to anybody you know. So in order to review what we've been talking about, right now, a lot of it is who do you know? And that's really what we need, because I'm down here in Boise and I am at Idaho Commission on Aging. And that means I don't get to know people that are in Post Falls and Rathdrum and even Pocatello and Idaho Falls and up north. So you guys are the ones with the local connections or the ability to make those local connections. First, please communicate with your own organization and your colleagues. What are they doing for falls prevention? And it doesn't have to be, hosting a huge event. It can be just sharing some information or putting our events on a calendar. But if they want to, of course, sponsor something else, that would be fantastic. You just have to let us know. Most of you work in organizations that do have contact lists, and I know that that can be a very touchy area. So ask the person who would know in your organization, can you use any of those lists? Can you have them do it? Not necessarily give us the information if you're worried about privacy. It can work in a lot of ways. We just need to get information out. So find out who that is to help disseminate falls prevention information and these events that can help keep people safe and falls free. If you're going to use any of your company resources, please make sure you check, do I need approval before I do something, or can I just send it out as whatever program person you are? I can't answer that question, but we want to make sure that we don't irritate, annoy, or madden any of our employers. So we just want to make sure that we know what's required. And if there is approval, how do we do that and how long does it take? Sometimes you need to give them a month or two to do things like that. Build your contact lists of your local community leaders, media, anybody that you know that's like an influencer in your area that can provide effective outreach and help promote both the coalition and ourselves. And what's happening, where you are. Some of you are involved directly with some of those things, but you may not be directly involved, but you still can let the coalition know about it so that we can again help promote it. Remember that your libraries, your fire departments, and your senior centers are all areas that every one of you have. They're in every county, and we just need to make those connections and start utilizing them as a mechanism to get the information out that we need to. All righty, well, now that I've lectured at you, I feel like this was kind of a lecture. I apologize for that. But we're ready to move, and I have been ready to move since January, hoping the grant would help with that, but it's not. But that's okay, because we are going to move forward with or without extra funding. If we get the funding along the way, it will help. So that's kind of our plan at the moment. Does anybody have anything else they would like to add before we finish up for today?
Erin, just an idea on the graphic design.
Yes.
Link did a project with Boise State's graphic design professor where they made it into a competition for the students to come up with ideas for gosh, how to really redo one of our rooms. And if you wanted to see if that was an option, you might need to not have a set idea of, oh, here's how we want it to look,
right,
and
right.
let the students really use
I
their
like
creativity.
that idea.
So I love the stuff they came up with.
That's a good idea. Yeah, I think we might approach that. Do you have the professor that you worked with, their information?
I can get it for you. Sure.
That would be fun. Yeah, and it also helps, again, whichever institution we work with. helps let them know that we are out here and we're doing stuff. So that's, I like that.
All the students in the class would be very well educated on fall prevention by the time they were done.
Absolutely. That's just a good byproduct of what's happening. And, you know, I have thought about that. We now have so many resources, especially in the Treasure Valley, of different people, different programs. We have CSI in Twin Falls and CWI, and, you know, universities and some in north and east as well, that I really think that we should start utilizing some of those students, give them some real world experience, give them some community service hours. And I think we are more than willing to allow them to do that. And it would be to our benefit and the benefit of those we're trying to help. So excellent idea. I'm going to have to run with that one too.
The other question that I have, if we have time, is I'm reading a lot in the news about cuts to public health. And I know there's a lot of people on this call who are in public health. So I just wanted to make sure or check in with how do things look? Are you guys stable? And any updates there would be appreciated.
I will start and say, as everybody knows, day to day, we don't know. I try not to worry about it because things change all the time. ICOA had a couple of programs that was part of that initial, we're just cutting off all of the funding. It's called a grant, even though it's something that is just basically done every year. So we did lose some of that. The Administration for Community Living, ACL, last I heard, I could be wrong, but last I heard, they basically were disbanding it, kind of like they want to do a Department of Education. They say, we don't need ACL on its own. We can put this part over here and this part over here and this part over here. So they laid off, or what's their word, administrative leave, 40% of the ACL staff. It was pretty much everybody at the top and everybody at the bottom, and they left everybody in the middle. So evidently, people who, for example, were working on these grants are still there and still able to, you know, make selections. But they also terminated all of the OPM, Office of Personnel Management people for ACL, which means there's nobody to process paying the bills or paying the grants. So who knows? Those are really the only impacts. I mean, there have been a lot of them, but that directly impact ICOA. Does anybody from any of our health districts or Fit and Fall Proof, have you guys had any fallout from any of the political movement?
Hey, Aaron.
Yes.
You know, this relates to housing. We did have one grant that a portion of it was suspended, but we just got notification yesterday that it had been reinstated.
Exactly. I don't mean to laugh because it's not funny, but it's just like you don't know what to do, because it's like one day this happens and then it's back and then it's changed. And so, you know, for most of us, we just kind of have to say, okay, as of this moment, this is what we know, but it could change. So I'm glad that's back, because we know that that's an area that a lot of people need a lot of help with, especially when prices are going up and all of those other things are happening. So, okay.
Oh, and I might add this related to a grant. We did receive a block grant funding from City of Caldwell for repairs. We are actively seeking projects in Caldwell, no matter how small. So if we can put that out there, if we know folks that need some help in Caldwell, pass them our way, because we're looking for projects.
All right, you guys heard it here. People that you know in the Caldwell area that need some projects done, contact me or contact Jim or contact Habitat directly. That would be fantastic.
Yep, thanks.
You betcha. Well, that's why we just continue doing what we've been doing, because at this point, you don't know what else to do. You don't want to stop planning. Like the grant, when I was writing the other grant, at first I was like, do I really want to put in another 80 hours of my time when that could just be cut off? And the answer is yes, because we don't know. And actually, it was not suspended or delayed or anything else. So you just got to keep going with what you know at the moment. And take a deep breath. All right, my friends, with that, we will go ahead and close out for this fantastic April Tax Day. Falls Prevention Coalition of Idaho Steering Committee meeting. We got lots of things on our plates, including our strategic planning that will be starting and planning for Falls Prevention Awareness Month. So stay in touch, read your emails, give me a call if you need anything, or call any of our other members about some of the things that you talked about that perhaps they can help you with, like getting a TBI assessment for one of your health fairs or your screenings, helping people with ramps or housing in Treasure Valley. We got it here. That's why we're called a coalition. So have a wonderful rest of your day, and we will talk with you all soon.
Great. Thanks, Erin.
Thank you.
Yeah, thank you. Goodbye, everyone.